I completed my general surgery residency and then did a vascular surgery fellowship after that. And my motivation was such that I loved the hemodynamic aspects about it. You had to know about how the heart pumps and how the blood vessels convey the blood to the circulation. You also had to know a little bit about atherosclerosis, lipid disorders, diabetes, hypertension. So some of the physiologic concepts that are common to medical education were right in the forefront of vascular surgery. I think there's a chance to deal with real serious vascular problems, aortic aneurysms, carotid artery disease, which can cause strokes, blockages in the legs, and if you can effectively deal with those problems, you can prevent strokes, rupture of an aneurysm, amputation of a leg, and so it's very gratifying when you can help a patient with those kind of serious problems. Well, an ideal applicant for vascular surgery may have changed a little bit. Traditionally, you went all the way through general surgery and then did 2 years of a fellowship. Now there's what's called a 0 and 5 program where a student can come directly from medical school and enter vascular surgery. It goes without saying we look for very bright and very motivated individuals. By and large, they select us rather than us selecting them. They self-select to go into this field. And I think it tends to be people who like the hemodynamic, physiologic parts of medicine. The challenges in vascular surgery are severalfold. One is keeping up with new technology. There's a lot of new technology out there. Some of it is the imaging technology that all of us use, so CT scans, MR scanning, different types of imaging that enable you to precisely diagnose problems. And then in contrast to the old days when we just took out a vein and used it as a bypass graft or took a graft off the shelf, we now do a lot of things that are catheter based. So two very distinct technologies are now part of the common treatment strategies of vascular surgeons, and it's twice as much information to keep up with. My consistent advice to medical students of any generation and going into any specialty is to follow your heart. If you're wise enough to think about what will keep you happy when you're 40, 50, and 60, then your decisions made at 20 and 30 will make a lot more sense. But follow your heart. If you love doing primary care, do primary care. But if you love surgery, go and follow your heart. I think that's particularly important for women medical students who often get the advice that, you know, you've got to take a controlled lifestyle. You can control your lifestyle in any specialty. It's a matter of arranging your schedule, time management, having good partners, and so on. So follow your heart, do what's going to make you happy when you're 50 and 60 years old.